Hello, hello, hello. So, as you all know or should know, October is Breast Cancer Awareness Month. So, I wanted to just do a video to give you some information as it relates to breast cancer. I did do an article that is available on my blog at drcharliedunn.com. So, some of that same information that I'm going to cover in this video is in that article if you want to check it out. So, let's just get into it. Again, this is Breast Cancer Awareness Month. You see, I got on my pink. Some factual information. Breast cancer is one of the most common cancers affecting women worldwide, with millions of women diagnosed each year. So, raising awareness about breast cancer plays a critical role in improving outcomes, as early detection significantly increases the chances of successful treatment. So, did you know that there are about 1 in 8, that's 12.9% of women globally, that will be diagnosed with breast cancer in their lifetime? According to the World Health Organization, in 2020 alone, more than 2.3 million women were diagnosed with breast cancer, and it remains a leading cause of cancer-related deaths in women, particularly in low and middle income countries due to limited access to early detection and treatment. So some of the risk factors for breast cancer can be categorized as modifiable and non-modifiable. Non-modifiable factors include age, family history of breast cancer, genetic mutations such as BRCA1 and BRCA2, and personal histories of breast cancer or certain benign breast conditions. Now, modifiable factors includes lifestyle choices such as alcohol consumption, obesity, physical inactivity, and hormone replacement therapy. Breast cancer is more common in high-income countries, partially due to the lifestyle and reproductive patterns, later age of childbirth, and fewer pregnancies. Now, early detection is paramount in improving survival rates. Breast cancer is detected early, especially those that are still localized, which means it's still confined to the breast tissue, have a 99% 5-year survival rate. However, if that cancer spreads to other parts of the body, which is called metastasis, the survival rate drops significantly. Now, there are two primary methods for early detection. Breast cancer self-examination. So that's basically when you're checking your breast yourself. And then clinical breast exams and mammography. So the clinical breast exams, of course, are done by healthcare professionals, and then you get the imaging, which is the mammography. So there are some screening guidelines as it relates to mammograms. It is recommended that women ages 40 to 54 have annual breast exams. Women 55 and older can switch to mammograms every 2 years, but can continue to do yearly mammograms based on their preference or their doctor's advice. And then high risk women, so those are the women who have the BRCA mutations or strong family history, may need earlier mammograms and also may need more frequent screenings. Now, while all cases of breast cancer cannot be prevented, there are several strategies that can help reduce the risk. So one is maintaining a healthy weight. Obesity, particularly postmenopausal obesity, is linked to an increased risk for breast cancer. So healthy weight management through diet and exercise can lower the risk. Regular physical activities. Studies do show that regular physical activity can lower breast cancer risk by helping to regulate hormones, reduce inflammation, and of course, maintain a healthy weight. Limit alcohol consumption. So even small amounts of alcohol have been associated with an increased risk for breast cancer. The American Cancer Society recommends limiting alcohol intake to 1 drink a day or less. And avoid or carefully manage hormone replacement therapy, also referred to as HRT. Prolonged use of hormone replacement therapy, especially combined estrogen progesterone therapy, has been linked to an increased risk for breast cancer. So you want to make sure that you discuss the benefits versus the risk of HRT with your healthcare provider so they can help guide you make the safest decision for yourself. Breastfeeding. So breastfeeding has actually been linked to reduction in breast cancer risk. So studies do suggest that breastfeeding for a year or longer can reduce that risk. The protective effect is believed to be related to hormonal changes that occur during lactation. Now, genetic counseling and testing is recommended for women with strong family histories of breast cancer or those who carry the BRCA1 or 2 gene mutations. Genetic testing, risk reducing surgery, or increased surveillance may be necessary. Sometimes preventive mastectomies, that's the removal of the breast, is recommended, and that can significantly lower the risk for breast cancer. So that's really all I want to share today. I just want to make sure that you all understand that breast cancer remains a significant health challenge, but bringing awareness and providing education and access to early detection can definitely help save lives. So just make sure that um, you're doing your self-breast exams. Make sure that when it's time for you to start getting the mammograms, you're getting your mammograms regularly or as recommended by your physician. Make sure that you're doing your annual physical. Make sure that you're going to your doctor regularly and getting yourself checked out. And make sure that you tell a friend, tell your family, and also I know that this video is geared towards women, but men can have breast cancer as well. Any person that has breast tissue, and we all have breast tissue, some have more than others, but we all have breast tissue. So if you got breast tissue, which we all have, then there is the potential for developing breast cancer. So you want to make sure you decrease your risk. You want to make sure that you're checking yourself out. You want to make sure that you're having your routine annual physicals. Okay. So what do they say? Health is wealth. You want to make sure you're taking care of your body. We only get one. So I just wanted to drop this video for you all. I hope that the information was helpful. Like I said, I have an article that I posted for Breast Cancer Awareness Month at my blog site, which is at drcharliedunn.com. And you can also check out my business page at gapsbridged.com. So yeah, I hope that, like I said, this video was really informative. Just want to raise awareness for breast cancer. For those of you who know me, you know that my mom was diagnosed with breast cancer back in 2003. She's doing well. She had her treatment. She's been great. She is thriving. But again, early detection is critical. So make sure, can't say it enough, make sure you're getting yourself checked out. But anyway, that's all I wanted to say. Be blessed, and you'll hear from me soon.
You know what to do. Where do we go from here? Don't let it rule you. Everything's gonna be alright.